Welcome. We are super happy to have you attending today's call. I'm Amber Daly. I am with Charter Senior Living. For those of you who don't know me, I am the National Director of Memory Care and Resident Programming. And today I'm going to introduce you to Deb Citrin. She is the VP of Marketing for Eversound. Eversound, if you don't know, they actually provide wireless headphone systems to senior living communities. And these devices are exceptional and they will totally blow you away. But what they do is really help those with struggling with hearing loss and also help a little bit with focus. And Deb's going to kind of tell you a little bit about that and introduce Diana. We're excited to have as our feature speaker today. So Deb, if you want to take that away, thanks.
Yeah, thank you, Amber, and good afternoon and evening to everyone. Delighted that you're here with us today. And as Amber was saying, Eversound is really fortunate to be working with Charter in some of their communities and providing our wireless headphone systems, which really provides a way to help those with hearing loss and also issues with focusing, engage more with the programming. And my colleague, Corinne, is showing you the headphones, simple headphones that are worn during the programming that is done in the life enrichment activities across senior living communities, including Charters, as well as they can be used for one-on-one interactions like family visits to help with communication, or one-on-one interactions between a resident and a care staff member. Could be physical therapy, occupational therapy, for example. And it's just about making it easier for people to communicate and participate and live life to the full volume. So we're delighted that we're able to provide these solutions that are specifically designed for use in senior living communities. But today, what we really wanted to spend some time on is really talking about hearing loss and the impact that hearing loss has on loved ones and residents. So I'm so proud that we were able to get Diana Sowers, who is a doctorate in audiologist. She's a practicing audiologist. She has a lot of experience with working with individuals who suffer from hearing loss in all ages, including those in their 70s, 80s, 90s, and 100s. So she's here to kind of educate us all on the challenges of hearing loss, how it happens, etc. So at this point, I'll turn it over to Diana, and I will be forwarding the slide for her. So you might hear her say, Deb, next slide. But I'll turn it over to Diana, and I'll ask Amber to mute herself as well.
Thank you for having me here today. Thank you for a terrific introduction, Deb. As Deb mentioned, I've been an audiologist now for 25 years, and I've seen a little bit of everything. And I'm going to take the opportunity today to talk nerdy with you about hearing loss and some of the effects that it can have on our seniors. I do see people with hearing loss in all ages, and I'm happy to entertain any questions that you guys throw out in the chat room for me. Also, anything that should happen to pop up in the chat, Corinne, please feel free to, wave the white flag and interrupt me, and I'll address the questions as they pop up. There's one in there already about getting a copy of today's recording, and I'll leave that towards the end of the discussion for everybody to answer that information. But here are the topics that you see in front of you are what we're going to be talking about today. If you don't see it on there and you want to talk about it, just ask in the chat and I'll be happy to do so. Go ahead and go on to the next slide, Deb. We already talked briefly about this. Thank you so much for hitting on what Eversound's mission is. It's basically to empower adults that have hearing loss and help them to perform better and have a better quality of life, and to do it easily. What we're hoping to achieve is better hearing with less effort, and to provide easier interactions between people by improving their hearing in a simple manner. Go ahead and move on to the next slide for me, Deb. So this is one of the slides that I really like to refer to as, this is your take-home message today. If there's anything that you remember going out of today's presentation, it's this fact that 80% of people over the age of 80 are impacted by a degree of hearing loss that affects their ability to communicate. So that's a lot. You look to your left and look to your right when you're at a senior living community, and you're probably looking at somebody that has a hearing loss. The three most common conditions that affect older adults are heart disease, arthritis, and hearing loss. And when hearing loss goes untreated, it's often due to the fact that we don't normalize it. We don't talk about it. And by not talking about it, it makes it difficult to detect and treat. There also is a fair amount of stigma that is associated with hearing loss that makes people uncomfortable, and they go to great lengths to hide the fact that they have hearing loss, again, making it more difficult to detect and difficult to treat. When we're looking at our seniors, that 80% of those over the age of 80 that have hearing loss, I think it's important to recognize that when hearing loss is present, your risk for dementia increases. And when there's a mild loss or mild hearing loss, you have a mild risk for dementia. And as your hearing loss becomes worse, your risk for dementia also grows. And I think that knowing that association between hearing loss and dementia is actually kind of frightening, but it's worth keeping in mind because it will affect a person's quality of life if dementia is present. Go ahead and move on to our next slide, Deb. So if hearing loss is so prevalent, why don't more seniors actually wear hearing aids? And there are a number of reasons why this is the case. The most commonly cited reason is cost, and I can't argue with that at all. They're expensive to get hearing aids. Insurance might cover for some folks and it might not. With Medicare is kind of dicey. Most Medicare policies or traditional Medicare policy will not cover the cost of hearing aids. Some Medicare supplements do. It depends on the supplement. So cost itself is a big issue for a lot of our seniors that are on a fixed income. Maintenance of the hearing aids is another issue that presents itself. Hearing aids can be teeny tiny devices, and when there's a degree of needing to clean teeny tiny parts with poor dexterity or poor eyesight, that does pose a challenge. And if those parts aren't clean and working well, the hearing aids themselves just stop working and making them basically an expensive piece of garbage in your ear. There's a fear that's associated with technology as well. And when you look at our older generation, I can remember 30 years ago watching my parents try to not have that blinking 12 on their VCR. I'm not going to explain to the younger crowd what a VCR is, but it's technology in general is frustrating for people once they get to a certain point in their lives. Hearing aids themselves, when they're presented to any generation, they'll note that there are multiple different manufacturers and different types and styles. You can have over hundreds of hearing aids to choose from, and all of them can seem like great choices, and many of them are. But having so many choices in front of you is another area that makes it difficult for people to move forward in choosing a hearing aid, is that choice anxiety. Which one do I choose? Having a reason to wear them is another reason why some of our older adults don't wear them. If they live alone, they might feel like it's not necessary, or having the intermittent desire or need to wear hearing aids makes it difficult to justify the cost of it. The other issue that's present is the need of having assistance to get to physical appointments. A typical hearing aid user that's a rookie or a first-time hearing aid user should plan on having 6 to 8 visits with their hearing care provider within the first year of wearing a hearing aid to make sure that they are properly changing their filters and domes and testing the hearing aid to make sure that and verifying that fit to make sure that it's working properly. It can be up to 6 or 8 visits, and that's a big burden for someone to put on their family, especially if they don't drive or take public transportation. 6 to 8 additional medical visits on top of the cardiac and the arthritis and other general health care types of visits. That's asking a lot from a person. Go ahead and move on to our next slide for me, Deb. So when a hearing loss happens to a person, there are experiences within your life that you will find are a bit dimmer than what they used to be. Um, One of the things I often recommend to people who have not personally experienced a hearing loss is to make a temporary hearing loss for themselves. Get a pair of those hearing protection devices, the little earplugs. You can find them pretty much at any sporting goods or automotive section of a store, and wear them for a few hours. Now, don't wear them in a situation that could be considered unsafe, like don't wear them when you're driving or when you're babysitting grandkids. You want to hear them even if they are screaming demons. Wear them when you're watching a TV show or when you're shopping at the grocery store, and start to focus on what you're not noticing anymore. Environmental sounds around you, the spin of the wheels on the buggy, the click when you push the button on your remote, all of these sounds that we take for granted will be dimmer. And when that sound fades, you're providing less stimulation in that pathway between your ear and your brain. It's a common phrase that we use in the hearing care world is use it or lose it. And if you're not stimulating that path, it can begin to atrophy. And that's part of that connection that we started to hit on between dementia and hearing loss. So I highly encourage doing that little experiment of your own with a pair of earplugs. Go ahead and move on to the next slide for me, Deb. So there are some common signs, and we're all aware of the huh and the what that people will say when they're unable to hear. Some signs are more common than others. I always think that for a lot of patients with hearing loss, it often takes another person to point out their suspicion before they start to recognize that they're experiencing hearing loss themselves. I always think of a patient of mine. She was 92 and getting her first set of hearing aids. And so I fit her with her hearing aids, sent her on her way, and she came back to see me in the clinic for a follow-up visit. And I asked her how things were going. And she had told me at that follow-up visit, things are great. My TV volume is down. As a matter of fact, after I'd worn the hearing aids for 2 or 3 days, my neighbors came over and knocked on the door just to check on me to make sure I was okay because they couldn't hear my TV anymore. My gut reaction to that was, oh, that's great. I love everything about that. And her response was, I could have been laying on the floor for 3 days and nobody would have checked on me. So I found it kind of funny, but it often does take that other person that observes a behavior to point it out and make the comment that there is something that's going wrong. Go ahead and move on to the next slide for me, Deb. So while there are some signs that are really obvious, like a louder television or leaning in to hear better or missing out on things that are said, there are other signs to watch for. And you might see some signs of this within your own communities where your residents might be avoiding situations or dominating conversations or becoming aggressive or having other types of mood-related changes that often go hand in hand with an untreated hearing loss. Look for changes in social patterns. Are your residents becoming more isolated and choosing not to meet their friends? Are they sitting alone and not going to activities? What happens too for a lot of those folks that aren't having that interaction, they're starting to show more signs of depression or anxiety that can be associated with that untreated hearing loss as well. That's one of the challenges that you have working in those senior living communities, is being aware of these subtle changes that occur over time. Go ahead and move on to our next slide, Deb. So why does hearing loss happen? Well, these are a few reasons why. These aren't this is not a comprehensive list of reasons why hearing loss can occur, but these are some of the more common things that we see causing hearing loss over time. One of them, of course, is noise exposure. And when you think about the residents that are in your senior living communities, a lot of the factory workers, men and women, that were actively working in noisy environments were doing so before hearing protection was mandatory. So they were fully exposed to a lot of noise for 8 hours a day or more, causing some of that damage. Some of our military veterans have noise exposure as well. So we know a lot of folks that live in senior living care spent some time in combat situations serving our country, and they might have some hearing loss because of that. Genetics is another reason why you got to play the cards you've been dealt. If mom and dad or mom or dad have a hearing loss, there's a good chance they may have dealt that card to you as well. And you got to think about medical history as well. As our seniors get older, their suitcase that contains a medical history gets fuller and fuller of different things. So there are some other common conditions associated with our seniors, like diabetes and heart disease, that can contribute to hearing loss, among other things too. And the aging process itself. Parts wear out over time, and when you get older, I know that some of my parts are wearing out. And if you remember the graph we looked at on the second slide, that gradual increase as you get older, you're more likely to have a hearing loss. Just the natural aging process itself is part of that. And go ahead and go on to our next slide, Deb. So now we know, some of the things that can cause hearing loss. We're going to talk just briefly about how does hearing work? So if you're following along on our picture here, you'll see a 1, 2, 3, 4, okay? And that little blue line is kind of the pathway, the swiggle line that goes through the ear canal onto the brain. When we talk about how hearing works, sound first has to enter the ear through the ear canal, and that's the first line where a problem can occur. I know from looking in a lot of ears, especially folks who are older, earwax is a thing that can block the path of our sound. Our skin changes as we get older, and it's not as self-cleaning, the ear canal, as it once used to be. Our skin becomes drier, our hygiene changes a little bit, where we might not be as effective at cleaning our ears out in the shower. From that ear canal, it moves on to the middle ear section where you see that snail-like shape and the little bones of the ear. And I know we talked a little bit about arthritis, and that's a problem that occurs in the mobility of bones and joints. And there's some bones and joints in that ear canal. There's also that long-term medical history. If you've had history of ear infections or fluid in the ear, this is where hearing loss can occur for some patients. We typically see that in children, but it does happen to adults as well. Moving forward onto the third part of this process, that's the nerve-related pathway. And this goes into that parts wear out over time. If you think of that little snail shell like a piano keyboard that's been rolled up into a little ball, there's a part of that is a high traffic zone where the sound will bombard the little hair cells and it will wear out, almost like that high traffic carpeted area that gets a little thin over time. Same thing happens to the nerve center of the ear. And that last section is number 4, and that's the brain. And we talked briefly too about how the Eversound headphones can help to improve processing and focus. And that's the part that we're looking at by improving your hearing and directly putting that sound path from ear to brain and reducing some of the other external factors that will interfere with hearing those sounds, such as background noise, other people talking, other distractions that can even be visual or physical that can distract. By heightening the hearing, it helps to engage a person in that interactivity. But you can imagine too, if there is any problem along the path in areas 1, 2, or 3, we're not getting the signal to the 4th part, the brain, and the brain has to work extra hard in order to make sense or process that signal that is heard. There are some cases where there are no problems at stations 1, 2, or 3, and it's the brain that processes the signal improperly. So there's a lot of different parts that are involved in order for the sound to get from the source to the brain to make sense of what's going on. I'm going to have you go ahead and move on to the next slide for me, Deb. So when a hearing loss is untreated, that path from ear to brain is no longer being accessed. And if you think about how the ear works, it doesn't blink. Your eye blinks, you close your eyes when you go to sleep, you get to shut that path off at some point. The ear is always open for business. And if that part can't get the sound from the external source to the internal source, There's atrophy that can happen over time. In the temporal lobe, that's the section of the brain that processes hearing. It also processes your short-term memories. And that's why that whole area and that location is closely associated with short-term memory loss and the warning signs and the early signs of dementia. If you're not feeding that stimulus to your brain doesn't get the nourishment that it needs, and it begins to shrink over time. And we're going to talk a little bit more about that when I get a little deeper into the dementia connection. Deb, I'm going to have you move forward to the next slide for me. This is my pause slide to make sure that I'm on target time-wise. Deb, are we on target time-wise? You're muted, but I see a smile on your face, so heads up. And I don't see any questions that have popped up in our chat at this point. But I would like to ask if there's anybody that has any questions or any thoughts they would like to contribute at this point before we move forward. 5, 4, 3, 2, 1. Okay, we can move forward. On to our next slide. So we talked about how dementia can be impacted by hearing loss that's left untreated. But in addition to that, there are other comorbidities that can go hand in hand with hearing loss. And one of them is falling. Falling is a big deal. And I've talked to many seniors about their fear of falling. And some of them get to the point where I'm afraid I'm going to fall, so I'm not going to walk, which makes it even more likely that they will fall when they begin to walk because they're not using it. It's a, if you don't use it, you lose it kind of scenario. People that don't hear well stop getting out of their rooms and going to engage in social activities. They don't want to get up and walk down to the dining room and have lunch with their friends. They don't go and participate in those activities that involve social interaction, verbal interaction because of the hearing loss. Less steps means less physical activity. Less physical activity contributes to the possibility of falling. Depression is another issue. And in addition to depression, there's also anxiety that goes with hearing loss as well. Depression is kind of a scary one that happens along with social isolation. There are some studies that are coming out from the World Health Organization that are suggesting that isolation, which can be seen with hearing loss, can contribute to increased mortality rates in our seniors. So those that have happy, social, active lives, interacting with their friends and family, are less likely to have depression and are less likely to have a higher mortality rate. Happy people live longer, so that's something to keep in mind. Some of these studies on dementia and the other comorbidities go back as far as 25 years ago. So this is not new information for any of us, but it has been very buzzy in the hearing world for the past 10 years in an effort to help attempt to reduce the statistic of dementia, which is also climbing. Some of the things that we talked about included the anxiety and depression, but there's also agitation and aggression. When people struggle to communicate their needs or with others, they tend to act out, almost like little kids do that are learning how to talk. They just have mental breakdowns when they're unable to express themselves or communicate well. And that's not only their expression of what they're saying, but their reception of what they're understanding. And if you're struggling to understand, that breakdown can often result in aggression and agitation. People also will lose a sense of independence. They can lose a sense of self-worth and meaningful purpose in their lives when their hearing diminishes. So having that purpose and that drive in life is what keeps us engaged in what's going on in our environment. Deb, I'm going to have you go ahead and move us on to the next slide. One of the things that I read that was a pretty frightening statistic too was from the CDC, and the Center for Disease Control stated that The economic cost to society of age-related hearing loss is estimated to be $297,000 over the lifetime of every affected person. I think that some of those costs are due to increased time that is needed for medical appointments for those that have hearing loss, lower job opportunities for people in the working world that have hearing loss. Also, for kids that are in school, there's a definite impact on the cost involved with teaching. So over the lifetime, we're hitting all age groups. But looking at our seniors, some of those costs could be associated with their risks for developing dementia over time. This slide, when I look at it, it's kind of this aha moment and another take home for those of you that are listening in on the conversation today. When a hearing loss is present, the risk for dementia is also present, and it has to do with that atrophy of the brain and that pathway not being achieved. The brain's not getting fed. When the hearing loss becomes more significant, the risk for dementia becomes more significant. When the hearing loss is present, the brain receives less stimulus and less nourishment. The brain begins to shrink. They have weighed the brains of people that have dementia and hearing loss. And I believe it is like a 1 cubic centimeter less of brain mass, depending on the degree of hearing loss and level of dementia present. Go ahead and move us on to our next slide, Deb. So one of the things that you can do is to improve your communication. Actually, hey, Deb, let's back up one slide for me if you can. I had a few more things to ramble on about. There we go. Thank you. So this documented brain shrinkage that we're kind of going on about here, that's connected with hearing loss. When we age, we lose some of our brain matter for sure, regardless of hearing loss status. But the folks that are experiencing hearing loss are flagged as fast-tracked for losing that mass, meaning they lose an additional cubic centimeter when they're compared to their peers that have normal hearing. So that smaller brain is related to having poorer function. One thing we haven't really talked about either is the stress on the brain that hearing loss causes. So remember that experiment we talked about where you are going to wear a pair of earplugs while you're watching a TV show, or you're going to cover your ears with your hands if you don't have earplugs handy, and see how it affects and stresses your brain and how much harder you need to work to understand what the television characters are saying on your favorite show. Those of you that actually do this experiment are going to understand that level of effort that you're putting forward to try to hear and trying to understand what it is that you're hearing. When you're using more brain power and hearing less of the message, what you're doing is a forced increase of what's referred to as cognitive load. Cognitive load is how much effort your brain needs to produce in order to complete a task. So if you imagine cognitive load like a gas tank, okay, and you've got so much gas in your tank, that tank has to last you for your entire day until you go to bed and you refuel. Okay. When you have a hearing loss and you're straining to hear and you're struggling, you're leaning in, you're cupping your hand, there's background noise that's present, and that pathway isn't what it used to be. Imagine that like revving the gas pedal. So you're hitting that gas pedal now, trying to understand what's going on around you. You're going to run out of gas. Every time you have to rev the gas, you're using more of what you had in your reserve tank. Now imagine yourself at other points in your day where you need more gas to make effective executive decisions, cognitive decisions, more in-depth conversations, any area where you might need to remember something. You're going to rely on what's left in your gas tank. And if you're out of gas, you're not going to do a very good job of that. By correcting your hearing loss, the studies that have come out, they show that, don't fear, you can correct this problem. The people that correct this issue, either by wearing hearing aids or wearing wireless headsets or making their lives easier, hearing better with less effort, are able to reserve the gas in their tank for when they really need it. So there's a solution to that problem. Let's go on to the next slide now. Here are some solutions to the problem that you can execute for very little to no cost. You want to try to keep your eye contact with the patient or with a resident so that they know that you're talking to them. Get to a quieter area. If you're struggling to hear, they're struggling to hear, say, hey, let's go over here where it's a little quieter to talk. I always use the wedding, going to a wedding reception as an example. Everybody knows everybody and everybody's talking, plus the band is playing. If you want to have a conversation with somebody, you're not going to do it in the same room as the reception is being held. Get them in the hallway, take them outside and have a conversation. Reduce some of the visual distractions or increase lighting. Those things can help to make better viewing abilities. Make sure the mouth can be seen clearly. And man, oh man, is that hard when masks are being worn. Use your best judgment, get 6 feet away if you can. And even if you have to drop your mask, I don't necessarily encourage that, but use caution for that. Speak clearly and at a moderate pace. Use different words if you can, and that can help people to understand more clearly. If you keep repeating the same sentence in the same word order and they're not getting it, they're still not going to get it. And I think it's valuable to suggest a hearing test. Again, you might be that person that kind of gives them that light bulb moment of maybe I am having some trouble because, Jane said she noticed I was having difficulty hearing. I wonder if other people are noticing that I'm having difficulty hearing too. Next slide for me, Deb. So to summarize the things that we talked about today, we talked about some of the conditions that affect our seniors, including heart disease and arthritis, but also hearing loss. And we also talked about talking about this to help normalize it. Untreated hearing loss can decrease the quality of your life. And there are some simple solutions that are out there that are cost effective and able to improve your ability to communicate with others. Hearing loss has been linked to cognitive decline, and there are ways to treat your hearing loss to help slow that cognitive decline. We want to keep the gas in the tank, people. Use it or lose it. And get your loved ones hearing tested. Get a baseline. Even if you think their hearing is okay, chances are if they're over the age of 80% of those over the age of 80 have some sort of hearing loss. I love it when I see someone who's over 80 and has normal hearing, but that's few and far between. Get a baseline. Have them tested so that they know exactly where they stand. Next slide for me, Deb. I want to thank everybody for giving me the opportunity to present on hearing loss and talk nerdy about all things associated with hearing. And I would love to open the floor for any questions that might be out there at this time. Do we have any?
We don't have any specific questions, but we had a wonderful remark from one of the attendees who mentioned that she herself suffers from hearing loss. And when you talked about kind of that cognitive load and the fuel tank, she definitely could relate to the fact that it's tiring, it's exhausting. Yes. Some of the things about you see irritability with some individuals, residents that have hearing loss or family members that have hearing loss. It's probably because their tank is empty by the end of the day and they just can't handle it anymore.
There was a study that had come out several years ago about people in the working world who are more fatigued by the end of their day because they're working their tushies off to be able to hear and process the things around them. So that hearing loss can make for I know that when mama gets tired, mama gets crabby. And the same can be said for anybody that is going through that moment of being fatigued.
Yeah. The other thing I was thinking about when you were talking about the experience of not hearing well is so many of us got to almost that aren't hearing impaired, got to experience what hearing impairment was like when we were all wearing masks.
Yes.
Right? And we
the
didn't
masks
have
and the barriers and the grocery stores, those plexiglass barriers, those definitely dampen the sound significantly. And everywhere I went, everyone I saw, anytime that where masks were being discussed as a problem, people with normal hearing would often, like you say, interject and say, man, I'm having a hard time hearing. My hearing's normal, but this mask and this barrier are causing a problem. And they didn't like it.
All right. There is a question that came up, which is, could you talk about other ways to communicate effectively when understanding words with masks or foreign accents prevent understanding words, even if the hearing works?
Yes,
And then it was like understanding and not understanding, what effect does that have on the brain, dementia, and cognitive load?
they do.
Great question.
Yeah, it is. So they do say that if you learn a foreign language, that is supposed to be very helpful to your brain. Also, playing musical instruments or listening to music are great food for the brain for training that aspect of your brain. But as far as how can you, as a person with normal hearing, understand how to hear a foreign accent better or comprehend speech better? If you're watching a television program, use the closed captioning. That's a great tool. It's free and it's there to use. So definitely use that. There are also some voice to text apps that you might be able to use effectively for somebody that you're really struggling with understanding. There are also some speech reading or lip reading programs. And if you don't want to pay the big bucks to go through one of those series, you can do some very easy lip reading skills to help kind of hone in your visual aspect so that you can focus on what a person is saying. A good example of that would be to get a very common children's book, Little Red Riding Hood. You know the story. And have somebody have the book open and read the book, but not project their volume, so that you have to practice lip reading. And then you say what you think they said, but you didn't use your hearing for it. You only used your visual pathway. So those are some things that you might do. And of course, listening to music, listening to audiobooks. Those are other great brain training activities that you can do to help you.
Yeah. Thank you, Diana. Another question that came in, which is, how can care providers improve how they communicate with dementia patients when access and masks get in the way of understanding words? And one of the things that I've experienced is asking people to slow down their speech. For a caregiver working with somebody that has a heavy accent or is wearing a mask, slowing down the speech really helps the receiver kind of comprehend better. But I'd love to hear from you.
I think, Deb, you're spot on with that. So if you think about our normal speaking rate and what a person with dementia needs to process, we're going too fast. And if we slow ourselves down or even provide some pauses in between ending our last sentence and starting our next sentence, that can be helpful. I would also recommend making sure that you have the person's attention. Say their name, touch them on the arm. If they're across the room and you want to get their attention, click the lights on and off so that they stop doing whatever activity they're engaged in, whether it's reading a newspaper, watching television, doing a crossword, or even just daydreaming. Get their attention first before you start your conversation, and try to keep your conversations in the familiar to them. You don't want to start talking about something that they don't really have any knowledge of. If they're not a basketball fan, don't talk about March Madness. But if they are a fan of gardening, ask them how their garden grows.
Yeah, it was interesting. The line of questioning was more about how the staff member, the carer, could better understand somebody with an accent, or that let's say the resident, the senior, is wearing the mask and they're having trouble understanding. What can they do with a resident that's living with dementia or a family member living with dementia in that case? Do you have any suggestions?
Yeah, that's a tough one. If they are a candidate for speech therapy, if they are mumbling their words, that may be something that could be addressed with your speech therapist on site. I know that some of my Parkinson's patients have a difficult time projecting their volume so that they're loud enough. You can always ask the resident if they can slow their rate of speech or project their volume a little bit more so that you're able to hear them. Even if I want to throw in the Eversound wireless headsets in there too, that's another way for even the staff person to wear the headset for a challenging patient to hear. If chances are, if you're struggling to hear that person, you're not alone. There are other people that are struggling to understand and hear that person directly. If it's for simple communication activities, even having a picture board might be helpful. If there's a common word or a common request from the patient, like, I want you to change the channel on my TV for me, and nobody understands what they're saying, get a little icon, a little picture board of a TV remote and have them point to it. And that could help to reduce frustration.
Those are great suggestions. Another question we have is a really intriguing one as well, which said, what if the ears can hear, but the brain is deaf? How
That's
to best communicate with that individual?
That's referred to as an auditory processing disorder. And sometimes we see some of our kiddos get diagnosed with that early on. Sometimes this can happen with a traumatic brain injury. Sometimes, following something like a motor vehicle accident or even a stroke. So you might see that the hearing sensitivity is normal or near normal. When I play a beep, a very simple sound, the patient says, yeah, I hear that. I push the button and we know they can hear it. But when it comes to understanding speech, it just comes across as garbage. It's very rare that we have somebody that has completely normal hearing and a deaf brain, but there are cases of that. It's more likely that there's going to be some hearing loss on top of that, and the brain itself is not completely deaf, but just struggles with the processing. So in order to improve that ability for the brain to process, we want to increase that signal if hearing loss is present. If there's no hearing loss present, usually tactics like Eversound's wireless headphones are great because it puts the stimulus directly in the ear. I have a local community group center here that uses something similar to that for the adult daycare program. There's a group of adults that are cognitively challenged, and some of that does have to do with traumatic brain injury or brain injury resulting from since birth. By wearing headphones during different activities that they do, whether it's watching a movie or art activities or even aerobics, those patients that are participating are able to stay engaged and interact because of that constant stimulus that way. If they weren't using something direct to the ear, there's a good chance that the mind would wander. But that's the thing, to have that auditory processing disorder.
The follow-up that was mentioned there was for dementia patients. I find that they cannot understand the message offered through speech. Is there a behavioral way of communicating? And I don't know, Diana, if you're the right person to ask this. That might be somebody who is skilled in dementia, particularly because it seems to be a little bit different than the hearing pathway to the cognitive function. A little bit, I don't want to put you out of your area of specialty and ask you to respond to something.
Yes, I would refer you to the cousin to my specialty, the speech language pathologist, who would be one that could help facilitate easier ways to communicate. There are augmentative communication devices that are available. Some of them are pretty expensive, but insurance may cover if the patient has a Medicaid benefit, or you can even create your own. I've seen a lot of creative people take laminated sheets of paper with simple pictures on it with a glass of water, a drink, a toilet, whatever kind of communication that you're trying to do, they might be able to use something simple like that to help them communicate.
And
that's a great suggestion. Yes,
Deb, I'm gonna jump in here because that's my wheelhouse, and I can easily answer this. We're not bringing up unconventional methods of communication, and only 7% of our words our communication is through the words that we speak. And then the 54% is our body language. So that is definitely how we're communicating with people with dementia and Alzheimer's, and then slowing down that communication. So you've got to have a lot of facial expressions, touch if that person's receptive to touch. And so your body language also has to match your tone and your inflection when you're speaking. And then that helps that communication sink into for that person you're trying to communicate with. And then, like Diana says, you do have to accompany that sometimes with pictorial visuals. So that is, something that, we could talk a little bit more about, but it's definitely an art for caregivers to be able to communicate with people who are cognitively challenged. It's not just hearing, but in the beginning, when the hearing loss starts, addressing that so that it doesn't atrophy anymore. So.
And repetition helps too.
Yes.
It doesn't hurt to repeat yourself.
Yes, always repeat yourself. If you speak a sentence, repeat the same sentence twice so that they have that opportunity to process the words you say. And if they still don't understand it, you can simplify that same sentence down.
What are your thoughts about having the patient with dementia when you've made a request or communicated something with them to ask them, can you repeat back what I've said to help it sink in? Do you think that that would be a good, fair tactic to try?
Yeah, so what we teach is basically if you've said, come with me, we're going to get a drink of water, and you've used so many words, that the trick is not to adjust it immediately, knowing I just used too many words, they're not going to process it. So we tend to change the sentence altogether, but they're still trying to catch up with the first, come with me and get a drink of water. So you really do want to say the same sentence 2 times to allow for processing. And then if they're still struggling to get it, you may say, let's get a drink. Let's get a drink. It goes down to 3 words, but you're now saying, come with me. So that's kind of the trick for people that are advancing with their decline cognitively.
All right. Any other questions? We're getting close to the top of the hour. Here's a question, Amber, for you. Is there training that chartered dementia care providers receive to help with the latter challenge of understanding? For example, accompany behavioral gestures with repeated sentences. So
yeah, absolutely. So we do provide communication in dementia is kind of what I call it. It's all your, it breaks down that 7, 34 and 50, I can't remember, 54%. It teaches a little bit about unconventional communication with a resident with decline, and that's accompanied, of course, by specific training about what type of dementia we're dealing with, because it does matter. So Diana could speak to aphasia and things like that, but if you're dealing with that, there's a lot of interventions that we need to put in place versus just straight hearing loss. So we absolutely do provide that. So if it sounds like you work for training, if for charter, so you're welcome to just kind of reach out to me, and you can email me and we can get you what you need in your community.
any other questions before we wrap?
Great questions.
I don't see anything. I don't see any other questions coming in. So at this point, I want to give a special thanks to Dr. Sowers for spending the time with us, sharing her knowledge, and making it interesting. Really appreciate that, Diana. It wasn't a dry subject. It didn't feel like you were getting nerdy on us. I think you had it right at the right level. Amber and Brad, thank you so much for giving Eversound the opportunity to host this webinar with the Charter Senior Living team. And thanks to my team for providing support and backup, Paul and Corinne. So thank you all. We will have a recording of this webinar that we can make available. We can send it out to the attendees as well as to hand it out to Amber so that you can use it internal for the Charter Senior Living team. A special thanks for those families that joined to learn about hearing loss in their loved ones. It's such an important topic. We often refer to it as the silent epidemic because it often is ignored. And as we learned from Dr. Sowers, keeping our hearing healthy and addressing it through treatment and other kind of accessibility devices can really reduce the health impacts and quality of life impacts on loved ones and residents. So that's our mission for Eversound, is to make sure that we educate around hearing loss and bring solutions to support families and communities. So thank you for your time. And at this point, I'll say good night for all of us.
Thanks, Deb. Thanks, Diana. This was wonderful.
It was my pleasure. Thank you, everybody.
Bye-bye now.